Hearing is one of our most important senses. It helps us learn, communicate, and connect with the world around us. For children, hearing is crucial for developing speech and language skills. It also plays a vital role in their social and emotional development. When children have trouble hearing, it can impact many areas of their lives. They may have difficulty understanding their teachers in school or struggle to keep up with conversations with friends and family. Hearing loss can also lead to feelings of isolation, frustration, and low self-esteem. As a parent, it can be concerning to learn that your child may have a hearing problem. You might feel overwhelmed, confused, and unsure of what to do next. The first step is to understand the different types of hearing loss and the available treatment options. Conductive hearing loss occurs when sound waves have trouble traveling through the outer or middle ear. This type of hearing loss is often temporary and treatable. It's like trying to listen to music with earplugs in. The sound is muffled because it can't reach the inner ear properly. Several things can cause conductive hearing loss in children. Ear infections are one of the most common causes, especially in younger children. When fluid builds up in the middle ear due to an infection, it can block sound waves from reaching the inner ear. Other causes of conductive hearing loss include excessive earwax buildup, foreign objects lodged in the ear canal, perforated eardrum, and malformations of the outer or middle ear. Treatment for conductive hearing loss depends on the underlying cause. For example, ear infections are often treated with antibiotics or ear tubes. If excessive earwax is the culprit, a doctor can safely remove it. In some cases, surgery may be necessary to repair a perforated eardrum or correct a structural problem in the outer or middle ear. Sensorineural hearing loss is caused by damage to the inner ear or the auditory nerve, which carries signals from the inner ear to the brain. This type of hearing loss is usually permanent. Think of it like a problem with the microphone or the wiring of a sound system. Even if the sound reaches the microphone, it can't be transmitted properly to the speakers. There are many potential causes of sensorineural hearing loss in children, including genetic disorders, complications during pregnancy or birth, certain infections such as meningitis or cytomegalovirus, CMV, head trauma, and exposure to loud noises. Unlike conductive hearing loss, sensorineural hearing loss is usually permanent. However, there are ways to manage the condition and help children with this type of hearing loss live full and active lives. Hearing aids are the most common treatment for sensorineural hearing loss. These devices amplify sound and can significantly improve hearing in children. In some cases, a cochlear implant may be an option. This small, surgically implanted device bypasses the damaged parts of the inner ear and directly stimulates the auditory nerve, allowing children with severe to profound hearing loss to experience the sensation of sound. Mixed hearing loss, a combination of challenges. As its name suggests, mixed hearing loss is a combination of conductive and sensorineural hearing loss. This means there is damage or blockage in both the outer or middle ear and the inner ear or auditory nerve. It's like having both a muffled microphone and damaged wiring in our sound system analogy. The causes of mixed hearing loss are the same as those for conductive and sensorineural hearing loss. A child might have chronic ear infections that have led to damage in the middle ear, along with an inherited condition that affects their inner ear. Treating mixed hearing loss often involves addressing both the conductive and sensorineural components. This might involve a combination of medical interventions, such as antibiotics for infections, or surgery to address structural problems, and assistive devices such as hearing aids or cochlear implants. Early diagnosis and intervention, key to unlocking your child's full potential. Early diagnosis and intervention are essential for all types of hearing loss, but especially for children. The earlier a hearing loss is identified, the sooner intervention can begin, providing the best possible outcomes for the child's speech, language, and cognitive development. If you suspect your child might have a hearing problem, don't delay seeking professional help. Early intervention services, such as speech therapy and auditory training, can make a world of difference in your child's life. These services can help your child develop the language and communication skills they need to thrive. Remember, you are not alone on this journey. Many resources and support systems are available to parents of children with hearing loss. With the right support, your child can overcome the challenges of hearing loss and reach their full potential.